Thank you, Steve. Before I introduce the speakers, I want to tell you a bit about how they came to be here. Our role within the health department, so within public health at the region, is to look at the health data and to look into the future and see what we see, and to tell counselors about it as well as our colleagues. So when we looked at the health data related to chronic disease, so that's my title as Director of Chronic Disease. It sounds a bit dull and boring and lame, as my children would say, but it means that diseases such as heart disease, cancer, diabetes that take a long time to develop and that are not easily treated. So when we looked at the data for these diseases looking into the future, what we saw alarmed us. Many large cities in North America are concerned about the increasing rates of diabetes, cancer, and heart disease. But in Peel, we have a unique challenge because of the composition of our population. The current rate for obesity in Peel is about 1 in 10, and in just a little over 10 years, we see that number going to 1 in 6. So when you stop and think about that for a minute, it's hard to imagine how you would have workplaces, your own teams within workplaces, your families functioning well if every 6th person has diabetes. These are really conservative numbers, too, by the way. So we immediately started to look across North America and really internationally to see what cities had managed to tackle this issue of heart disease or diabetes prevention and done a good job of it. And New York City was certainly on the list, and in fact they were the list. So they have, through some very concentrated efforts across their city departments, changed the rate of physical activity among New York City residents and made people more active. So they've seen increases in physical activity. They've seen increases in fruit and vegetable consumption. And just a few minutes ago, I was talking with one of our regional counselors who, when they were in New York, was amazed to see food carts within urban parks that provided fruits and vegetables rather than just the famous hot dogs. And they've also seen an increase in public transportation, especially for commuting, which indirectly helps us within the health department because we see an increase in physical activity because you have to walk to get to public transportation. So we wanted to look at what New York City had done, and what was very interesting to us is they didn't do it as a health department. They did it with many of the people who are in this room: the transportation planners, transportation engineers, planners, architects, designers, capital works staff, those folks whose work it is to design the space that people move in their everyday lives. So last fall, I'd asked Steve, and it's a brave thing to say, okay, sure, Gayle, whatever you want at your event, I'll do that. So and Steve facilitated an afternoon discussion and met some of the New York City folks that we had brought up to talk to us about how they had achieved these great changes in physical activity and nutrition. And he was so inspired about them. I mean, just last week he was saying, it's just so inspiring to have those New York City people here because they didn't just talk about this issue of preventing chronic diseases, they actually did it. And they did it by working together as planners, engineers, and health staff. And whenever they encountered challenges, which inevitably you do with a problem this complex, they didn't buckle. They kept their eye on the ball and they kept problem solving until they were able to see some changes. So it was that inspiration that caused us to, Steve and I, to agree that we would have the New York City folks up again. And that's why it gives me a great deal of pride to introduce them. But I wanted also to mention that after they were here last time, we had a parade of council resolutions. So perhaps you'll have some of these in the next month or so, Steve. We had about a record number for health, 5 or 6, really. And these function as direction to us as health department staff. So after the New York City folks left town, we had direction from council to work on putting exercise equipment in parks at a municipal level, in particular in Mississauga, to open up the stairs within our regional buildings so 3,000 people could start taking the stairs on a daily basis, and to change the food within our regional facilities to make sure that it was as healthy as the salad bars that they've managed to put in every single school in New York City. And as well, to look at outdoor spaces beside our buildings. In particular, we're going to create a design beside the 7120 Hurontario regional building, so at Hurontario and Derry, so that staff are not pouring out onto the street at lunchtime and contributing to the congestion that happens locally. So you start to see how just by creating space beside a building so staff can have outdoor meetings or mobile meetings or be active in outdoor exercise equipment and their breaks, you can see where health department staff and Steve's staff who are worried about energy consumption come together to work in a more productive way than we might have in the past. So I thank Steve for the opportunity. I'm happy to sponsor these two speakers and to tell us more about the work that they've been doing in New York City. I'm proud to introduce Karen Lee on our left, who is a medical officer of health by training. She is also the sole medical officer of health working in New York on built environment and active design. So she's the director of built environment and active design. And to her left is Alex Washburn, who is the chief of urban design for New York City. Welcome, Karen and Alex.
Thank you. Thanks, Gayle. Thank you, Steve. And thanks, everyone, for being here. Oh, yeah, okay, I see the slides are up. So today I'm going to talk a little bit about, designing healthier environments to synergistically conquer disease epidemics and to concomitantly address environmental sustainability issues, because there's actually a lot of overlap. Not complete overlap, but many areas in which we overlap. So I'll start with, just a few historical slides. And this history pertains not just to New York City, but to many of our cities in the developed world, increasingly in the developing world as well. If you look at the developed world and the cities in them and local regions, in the 19th century, infectious diseases were the leading causes of death. And how we fundamentally defeated these diseases was actually through our infrastructure. How we designed our water systems, our sanitation systems, even our buildings to allow light and air to enter them. In the 21st century, a different set of diseases, as Gayle said, the chronic diseases. Many of these we can think of as actually diseases of energy, because of course, physical inactivity, a key risk factor, or unhealthy diets where we consume too many empty calories, are actually tied to the energy equation, right? If we're not moving, we're not actually using our bodies. Usually it means we're actually using some external source of energy that then has implications for our environment. If we are consuming too many calories, again, that's an energy consumption issue. And so many of the design solutions actually for these current epidemics actually very much parallel environmentally sustainable solutions for our communities. So this just shows you the deaths from infectious diseases. In 1880, leading cause of death, about 60% of deaths. By 1940, these deaths had dropped to 11% of deaths, right? In 2011, 9% of deaths in New York City are due to infectious diseases. So you could see between 1940 and 2011, the gains that have been made have been relatively small. And yet, that was the time when, most of our medical technologies, including antibiotics, have actually come into availability. But in fact, most of the conquering of these diseases occurred before the widespread use of antibiotics, and it was really through measures like these. In the 19th century and early 20th centuries, in New York, we had multiple cholera epidemics. What did we do? We actually, after these epidemics, at some point, the city said, we got to create a new water supply. That downtown pond that has dead animals floating in it, I guess it's just not going to keep working for us because these epidemics are rampant. So the new reservoir called the Croton Aqueduct in upstate New York was created and remains today's water supply. Those epidemics went away, they didn't come back. 1857, Central Park was created, hailed as ventilation for the working man's lungs. Department of Sanitation was created. The Tenement House Act actually banned the construction of dark, airless tenement buildings, so now all buildings had to have windows. Light and air could enter, there was circulation. First section of the subway was actually created in large part to deal with the very severe overcrowding that was occurring in Lower Manhattan in the early 19th and late 19th and early 20th centuries. 1904, the first section of the subway opens. People can now live in the Bronx, in Upper Manhattan, travel quickly down for commerce down in Lower Manhattan. and even zoning ordinances that required buildings to be stepped back such that light and air could enter into the streets. You know, all of a sudden, those puddles that would stay dark and dank and breed mosquitoes, they dried up, and those mosquitoes went away, and the yellow fever epidemics associated with those mosquitoes also went away. So of course today, you know, we've got a different set of diseases, chronic diseases, diabetes, heart disease and strokes, cancers. And if you look at chronic diseases, they are now the #1 cause of death globally. They have been the #1 cause of death in the developed world for the last half a century. The leading risk factors for these deaths are tobacco use, physical inactivity, unhealthy diets, and inappropriate use of alcohol. So according to the World Health Organization, we have 36 million deaths per year due to these diseases, and the bulk of them are preventable. And some of you may have seen these maps. They're of the obesity epidemic in the United States. 1985, the US Centers for Disease Control and Prevention started collecting data on obesity rates in US adults. So they would ask adults through surveys on the telephone what their weights and heights were, as well as other health parameters. They would then use the heights and weights to calculate something called the body mass index. Body mass index of 30 or above is considered obese in adults. And you could see in 1985, when this data collection began, there was no state above a 14% obesity rate. And you'll see this change very quickly. 1991, we've got a new color above 15%. And continues to change very rapidly. By 1997, a new color above 20%. And it doesn't stop. 2001, 2002, new colors again above 25%. And, you know, by recent years of 2009, the vast majority of states now above 25%, many states above 30%. How rapidly this has occurred is one of the reasons this is called an epidemic. Following that, of course, are diabetes trends of type 2 diabetes. You know, when I was going to medical school, type 2 diabetes was actually called adult onset diabetes because you rarely saw it under the age of 50. And today, of course, you know, it's increasingly being seen in young adults, in teenagers, and of course, complications from diabetes develop as a matter of time after you get diabetes. And so if people in their 50s and 60s previously were getting complications like blindness, heart disease, you know, limb amputations, kidney failure requiring transplants or dialysis, the question is, you know, the kids that are being diagnosed with type 2 diabetes now, and the teenagers, when are they going to get their complications? Probably at the prime of their adulthoods and in their working years. So there are huge implications not only for healthcare costs, but actually the sustainability of the workforce, of our tax base, and many of these issues. So you've seen how quickly obesity and diabetes have increased. We've often heard the debate, you know, is it genetics? Is it our environment? Well, we know our genes don't change in a matter of decades. But if you look around us at the environments that we now create, they've certainly changed tremendously. It's very easy through the course of the day to not move at all, whether it's in our buildings, on our streets, getting to and from places, you know, and then of course unhealthy, high-calorie, empty nutrient foods are everywhere. And you know, studies show that if you know you have unhealthy food everywhere, if you expose to food, if food is there, people will eat it. And so the exposure to healthy versus unhealthy food is actually an important element. At the same time, particularly over the last decade and two, there's been a growing set of studies showing that how we design our buildings, streets, and neighborhoods can in fact have huge implications for whether people will take the stairs every day, as an example. You know, there's a whole host of strategies can be done to actually improve stair use. Everything from posting a simple sign at elevators and escalators encouraging people, reminding people to take the stairs, to you know, better stair designs, more visible and convenient stairs, and even just having access to the stair, because in many buildings that's not even the case. Designing to increase active recreation. So in leisure time, if people actually have places to play actively, to exercise, and it's nearby to where their homes are or where their work sites are, we know that this is associated with increases in physical activity during leisure time, and it's associated also with lower weights in both children and adults who live near these facilities. And then, of course, designing to increase active transportation. So, neighborhoods that are supportive of walking because there are sufficient amenities to walk to with good sidewalks, or cycling, or transit access, which, of course, is also associated with, the walking at some leg of the transit trip, either from the transit stop or to and from the transit stop. These things actually are associated with increases in physical activity of 35 to 160%. And similarly, on the food side, there are roles that decreasing access to unhealthy foods and exposure to unhealthy foods can play, increasing access to healthy foods, as well as giving people point-of-decision information. So, we often hear about, we have to give people information, we have to educate them. Well, actually, the health data is playing out pretty strongly that, just telling people what to do without a supportive environment doesn't work very well. And they'll very soon fail in those behavior attempts. We know that people want to make these healthier behaviors. If you look at the top New Year's resolutions, what are they? People want to quit smoking, they want to lose weight, they want to exercise more, they want to eat better. But by February 1st, they've thrown up their arms in despair, right? And because of their failures, and part of that failure, right, and why the majority of our population is overweight and obese today is because we live in an obesogenic environment, an environment that actually doesn't support those behaviors being carried out day after day after day. And this is the role, I think, that built environment professionals actually have a huge part to play in that, the environments that we create, that we operate, that we design, really can shape those behaviors and help people do the things that they actually really want to do. So basically, if we're going to do this, we have to do it together, right? And just as we did it together over a century ago when we conquered those infectious diseases. Health and planning, for example, really grew up together, and then they actually diverged and moved apart. But now we're seeing them come back together again, and we're seeing them occur in more and more cities around the world. So to not do it actually is to actually get left behind, because from what I can see around the world, more and more cities are now undertaking this because they recognize that they must do it and that there's so many synergies in doing it. So the need for partnerships across sectors, there's synergies and co-benefits, and we need to identify them. There are really complementary roles for the partners. So people like myself in health and Gayle, we can tell you what the health data shows about these epidemics. We can bring the health studies to you and let you know, hey, this is what we know from the health studies. But the actual opportunities in both the policy realm and in the practice realm, those of you who are working in each of your sectors, you know where those opportunities are. Like, in our work in New York City, it's folks like Alex with the Department of City Planning, our partners in transportation, in public works. They've been the ones who've actually told us where the opportunities are, where we could actually insert health elements and address health elements, both from a policy and from a practice perspective. And because of that, those ideas being shared across sectors, I really believe that's why New York has seen the types of successes that it's seen. And you'll see some of those in upcoming slides. So there's actually a really important role for co-leadership in these issues, because they are fundamentally complex issues in complex systems that require multiple sectors to really co-own and to co-lead and to co-address the opportunities. One of the things that we do in New York is we have conferences on an annual basis. The next one's actually going to be in June 24th, 25th. My understanding is some folks from Peel are going to be coming. Some of the others of you who are here might want to come as well. And anyways, the Fit City conferences are a conference that bring together planning, architecture, development, green buildings professionals, and health professionals together into the same room year after year to actually talk about what we can do together, to celebrate the successes of the past year, and to identify what other elements we need to do in the upcoming year. And we have folks from the public sector and the private sector. One of the ideas actually that came out of Fit City 2, the second Fit City conference, was that, the different city agencies should actually get together and create a set of guidelines that can address these issues. And so this was how the Active Design Guidelines was born. If you haven't seen the guidelines, you can download it at nyc.gov/ADG. And there are 4 chapters. There's the background, some of what I've talked about. There are the best practices and evidence-based strategies for urban design, street and community scale components, neighborhood scale components, evidence-based and best practice strategies for building design, and then a whole chapter actually on synergies. And the synergies chapter was actually put in at the end because folks like yourself who came together in a design process and a design charrette process to give input into the guidelines told us that there were many synergies that we needed to capture and actually highlight. That there were synergies with accessibility and safety and sustainability that I'll show you in a couple of slides. So this is just an illustration of all of the members, all of the partners who were involved in the development of the guidelines, public sector, private sector. From the public sector, we actually had a total of 12 city agencies, and the whole process was actually co-led by 4 city agencies. So out of that, we've continued to have cross-sector initiatives busy implementing the guidelines since they've been released in 2010. And like I said, some really key synergies that have been identified by health working with you folks in the other sectors. And they include benefits for sustainability, which of course is really relevant to this conference. So I think the most common one that we think about is the active transportation area. If we're not taking the car, but we're walking, cycling, taking public transit, there's energy implications, there's air quality implications, and of course, there's physical activity, and therefore obesity and diabetes and these chronic disease implications. But actually, in the whole host of other realms, there's actually these synergies as well. So for example, stair walking, right? If you're using the stairs on a regular basis, you're not actually using an electricity generating device, which are elevators and escalators. I saw a statistic on the web that said, an escalator running 24 hours a day, 7 days a week, can generate something like 4 carloads of carbon dioxide per year. That's actually not insignificant. And my understanding as well, from a building maintenance perspective, is that these escalators frequently break down, and so the cost of maintenance of escalators is actually a high-cost maintenance item. The other is, active recreation. If you design facilities, as I said earlier, to actually encourage leisure time physical activity, kids will play more, people will be more active. And so if we're designing facilities that people can go to actually play actively with their families, this is a potential opportunity to shift people away from televisions. Televisions are actually associated with obesity, particularly in children, not just from a physical inactivity point of view, but from actually eating while they're watching TV and from exposure to food advertising, right? And then they're then nagging their parents for all of those junk foods that they see during children's commercials. The other thing as well is, from an energy perspective, in a state like New York State, TVs are anticipated to very soon overtake refrigerators as the main source of household appliance energy use. So whatever we can do, I think, to get people to turn off those televisions and to actually leave their, houses and apartments to play actively in the summertime, that can actually also save you on energy costs from air conditioning use. Of course, we know that combination of sitting inside watching television with the air conditioning full blast on very hot days in the summer is one of the reasons we get the types of blackouts that we see in some of the cities in the US and even Canada. Bottled water versus tap water is the type of argument that we often hear on the environmental front. Well, all of those highly caloric beverages like sodas and, that are high in sugar, high in calories, that actually contribute significantly to the obesity and diabetes epidemics. Well, what do they come in? They come in cans and bottles. They go into the landfill, those cans and bottles. And they have very high transportation miles associated with them. Similarly, highly processed foods, they often come highly packaged. They have high transportation miles and they go into the landfill. Whereas if you think about fresh food, healthy food is usually fresh food. You know, it actually leaves very little waste, right? And the waste that's left is actually usually compostable waste. And so there are these many reasons for an environmental front. And this slide just basically talks about, you know, the percentage of energy usage that's from transportation. This is in the US, but, you know, similar things are seen in Canada and globally. You know, in a building-rich environment like New York City, buildings actually also contribute very significantly to energy usage. And then there's also actually benefits not just for the environment, but for accessibility issues. Realms, very walkable realms that have good wide sidewalks, good crossings. They are actually with services around where people live and work. These are exactly the same types of realms that actually increase accessibility for people as they age, so they can age in place, as they need to move with walkers or with canes, as people who have disabilities, right, can access the public realm if there are in fact these good wide sidewalks that are well paved, and they can access services close to where they are from these types of amenities. But even, you know, on a building scale front, you know, our Mayor's Office of People with Disabilities actually said to us, oh, you know, even like encouraging stair use amongst people who are able to use the stairs, it's actually quite important for people who have disabilities in their use of elevators, because as long as elevators are available for the people who need them, it's much more usable if it's less crowded. You know, those really crowded elevators that are stopping at every floor is not particularly user-friendly to someone who's in a wheelchair, as an example. There's also actually a whole host of economic benefits that are now starting to be quantified by studies. So, you know, very sprawled communities, much higher infrastructure costs, not just in development, but in maintenance over time, compared to more compact communities. And then even households. You know, people who live in auto-dependent neighborhoods, on average, and the study showed, they spend about 25% of their incomes monthly on transportation. And it's only 9% if you live in a walkable, transit-rich neighborhoods where you actually have the choice to drive or to use one of these other modes. Job creation, right, which of course is always important to all of our communities. Job creation, this study basically shows the infrastructure for roads that actually includes pedestrian and cycling infrastructure creates more jobs per $1 million spent than road infrastructure spent on cars alone. And that's because of the relative savings on land costs, because usually these developments are more compact, but the intensivity on each mile of the road for construction. Also, you know, this is a poll done by the National Realtors Association in the United States. They poll the US public every year to get a sense of what their customers want. And for the first time in 2011, they're showing that more people want to live in smart growth communities, communities where they have the option to walk, to bicycle, to take transit, compared to completely auto-dependent communities. So the trends are actually, the market trends are also shifting. So in New York, and I'm going to go through these last slides very quickly because Alex is actually going to tell us a lot more about all of the initiatives that are occurring in New York City. You know, one of the major things in New York City has been our Plan NYC plan. This is our master plan, Plan NYC 2030. It is planning for the anticipated 1 million new residents who are going to be in the city by 2030. It's at 8 million now. And of course, there's all sorts of implications, right, of the new 1 million residents. There's implications for housing and the availability of housing and affordable housing. There's implications for the environment, because of course, we don't want 1 million more cars on the road. So there's implications, therefore, for what we need to do around transportation, around infrastructure. And you know, in the first version of Plan NYC, because we were just beginning this work together in New York City, there was a lot of elements that we knew were going to impact health from what we saw, but health was not called out as a specific element. Now, through our work together in 2011, when version 2 was released, health is now called out as a very specific item that is also a co-benefit in addition to all of the environmental elements. There's a whole host of programs, and here I just wanted to demonstrate that, you know, We have a whole public plazas program in New York City that is about creating more walkable spaces through, you can take intersections that are very dangerous, that actually are unwalkable, and through just inexpensive paint and plant potters, start to create, pedestrian plazas that create an additional destination for people to walk to that makes for a more pleasant walking environment. And of course, in places like Herald Square and Times Square, where we knew there were already huge pedestrian volumes have continued to go up. And traffic flows actually show that with better designs, using those plazas, but better traffic flow modeling and designs, traffic flows actually can get better. Economic outcomes, so retail outcomes around these areas have actually improved. Retail vacancy storefronts have dropped. And in Times Square, retail is actually up in terms of sales in the local stores. Because of course, we know that when people are stuck in traffic, they're not getting out of the cars and running into the stores to shop. But when people are on foot walking around, they often mosey into the nearby stores. And so there are actually these co-beneficial outcomes. Bicycling is now up in New York nearly 300% from the concerted efforts through bicycle parking, through the creation of more and more bicycle lanes, protected whenever possible. And of course the bike share, which is going to be coming to New York City very soon. We've been, of course, also within our buildings we've been promoting the use of stairs with, these simple signs that say burn calories, not electricity. We've done studies on these showing that, stair use will increase after you post these in buildings. And, in some of our buildings, they're staying up at, 9 months after these things are posted. You're still getting a 40% increase above baseline. One of the things that our other sectors and partners told us in health when we began this work, actually the very first Fit City conference, was that in New York City, Local Law 86 was coming into place. And Local Law 86 would make all public sector buildings and publicly funded buildings, or significantly funded buildings significantly funded by the public sector, it would make them necessarily green buildings if there were new construction or major renos going forward in 2007. So one of the things that architects and developers said to us was, because of this law, and the need to use LEED, most of it's through LEED certification at the silver level, can you guys actually create an additional incentive in LEED and through this law by creating an innovation credit for some of the parameters that are not captured in the current LEED system? So of course, for me in health, I was like, LEED, yes, I don't know what LEED is, And so, fortunately, of course, our partners were like, well, here are all the materials you have to read. And what we ended up doing was we looked through LEED, and we actually saw, of course, that there's already a whole host of things like bicycle storage, change rooms, public transportation access, community walkability, density, a whole host of parameters that already are given points within the LEED system. So the key is to use these points routinely, but for the elements like active recreation facilities, or buildings that actually use features that promote stair use and help to save on elevator energy use and elevator usage and escalator usage. We created elements and an extra innovation point, which is now actually, we're happy to report, it's been used in multiple buildings in New York City successfully. It's been used in a college campus in Miami. It's being used in a healthcare a children's hospital in California. And the U.S. Green Buildings Council actually, so affordable housing, offices, hospitals, and the U.S. Green Buildings Council actually recently made this a part of the pilot credit library. And so there's now a pilot credit library credit called Design for Active Occupants. And they are trying to encourage the use of this pilot credit amongst projects in the U.S. Certainly you can use it here in Canada as well. And as I said, it's called Design for Active Occupants, and you can find it in the LEED system under the pilot credit library. So these are the types of impacts that we've been able to see in New York City. Commuter cycling increased nearly 300%. Despite really high transit ridership, we continue to see increases in transit ridership. Bus and subway ridership up 10%. And one of the things that's been done in New York is the areas underserved by the subway. There's been concerted efforts to actually introduce bus rapid transit by bus-only lanes and also inclusion of bus rapid transit infrastructure. We've seen increases in stair use in the buildings that are using the stair prompts and undertaking measures to promote stair use. And like the stair promoting signs that I talked about earlier, we are seeing those signs now being used in, we've distributed over 30,000 of those signs. They're being used in over 1,000 buildings in the city. And those signs are being adopted and used in places like London, England, in, other cities like Portland, Oregon. So I think that health and green message is actually really resonating as well. We've seen increases in fruit and vegetable consumption through concerted efforts to increase access to fruits and vegetables. We've created, jobs actually through the types of initiatives that we've done around creation of supermarkets, through tax and zoning incentives in our food desert areas. And at the same time, we've seen traffic fatalities drop. We've seen car volumes drop. We've seen car registrations drop. Air pollution has gotten better. For example, we measured air pollution when we pedestrianized Times Square, and air pollution levels are down. And of course, New York City has now seen a reversal in childhood obesity. It's one of the few cities in North America and around the world that has been able to see this reversal through a very comprehensive approach. Now, I would say that it's not just in the city, though, because there are other cities that New York has also recently worked with in the last 2 years that have taken a very comprehensive environmental policy and systems change approach to obesity. They've seen those drops too. San Diego, Philadelphia, they've actually seen recent reversals too in childhood obesity. So in a relatively short period of time, the cross-sector partnerships, doing things together, finding solutions together, has really made a tremendous difference. So thank you, and thank you for your attention, and I'm going to turn it over to Alex.
Oh, thank you.
There you go. Gin and tonic.
Great, yeah. Hello, everyone, and thank you so much for inviting me up today. It's a pleasure to be up here in spectacular weather and in spectacular company, like Dr. Karen Lee, who I've had the pleasure to work with now for almost 7 years on this joint effort to bring health into alignment with the policies of sustainability and civic improvement that we have in New York City. And that's what I'd like to talk a little bit about today, is the role that urban design can play in this effort of alignment. I'll start with a few observations about urban design, what it is. Urban design is that practice at the center of the others. We're the ones holding the pens, and around us swirl the economists, the program managers, the politicians, everyone who has input. We try to synthesize it and draw, put it on paper, make it visible. The type of design we do is at the nexus of politics, finance, and design. What I mean by that is that you can be the greatest designer in the world, but if you can't work under political pressure, if you can't work under the constraints of finance and profits, you're really not an urban designer, because urban design's main job is to bring things into reality. Even though we work at the scale of the city, the smallest dimensions matter. And we also find that in public space, if it's worth remembering, it's worth drawing. And by drawing, we get the space inside ourselves. We can understand it in a way that you can't understand it just by taking a photo. Finally, something that took me quite a long time to learn is that listening is what changes the city. Okay, let's go back to something that Karen mentioned, which was Plan YC. Plan YC originally came out in 2007 on Earth Day, and it was a aligning, overarching plan that applied to all the city's agencies that was meant to deal with two facts of existence in New York City: that New York City is growing and that climate is changing. It set the tone, the agenda, for our urban design tasks for the 21st century. The first is how to grow the population of New York City by 1 million people in the next generation. And this is a map of where those 1 million people are going to go. It overlays directly on our subway map. In essence, it's a validation of a strategy that we began in 1904, which is transit-oriented development, to put our highest density at our greatest transit nodes, and places that aren't served by transit to allow them to downzone. Remember, New York is not all skyscrapers. We have a full range of density in the 5 boroughs. We even have a trailer park in Staten Island. The second agenda for urban design is to deal with climate change, to adapt our city to make it resilient to the climate change that has already occurred, and to mitigate our carbon emissions and therefore reduce our effect on future climate change. New York's a little different from other cities. We have a very low percentage of our carbon emissions that come from transportation, primarily because our subways use so little energy per person per mile. And you can see the small dot on the subway entrance there of 1.4%, showing you how much of our CO2es come from the operation of something that carries 7 million New Yorkers a day. The final part of our urban design agenda, if we can accomplish the 2 previous ones, if we can find a place for 1 million more New Yorkers, and if we can adapt the city and make it resilient and mitigate our carbon, we still have to improve the quality of civic life. The other 2 wouldn't matter unless we could accomplish this. And for us in New York, we see that improving civic life means improving public space. It's an intergenerational endeavor. A long time ago, improving public space meant building buildings with classical architecture. It began with the Greeks, but we've been doing it for thousands of years. This building here is the Farley Post Office. It was built about 100 years ago by the federal government, basically as a form of patronage to the city to show how much it appreciated the city's votes in Washington. And it is the largest giant order Corinthian colonnade in the Western Hemisphere. Well, now that's not in play any longer. The paradigm has changed. Green is the new civic. If you want to do something good for your city, you build not a Corinthian column, but something that has green infrastructure, like a green market or an urban forest. This is my daughter Athena in a beautiful forest that's about 500 meters from Wall Street in Battery Park City. The city and its environment are one. Plan YC was a very technical document, a series of 135 programs for adaptation and mitigation, but underlying it was a sense of ideals, of values, call them civic virtues. On the adaptation side, these are virtues of prudence. And I'll show you a quick example. We had a very short, heavy rainfall in August of 2008 that flooded our subways and in essence shut down the city. We realized that this water was coming in from the subway grates, and we realized that we had to raise these grates in order to give time for these rain showers to be absorbed by the sewer system and not overtop the subway. But in solving that technical challenge, we wanted to improve the quality of civic life, the quality of the public space. So working with Grimshaw Architects, we came up with these little devices that raised the grates just enough to provide the buffer, but also gave you a good place to park your bike and to sit down and hopefully improve the cityscape. So that's a small example of what I would consider a successful urban design move. On the mitigation side, typically what one does to save energy is to insulate and change the light bulbs to fluorescent. But in New York, we have a different strategy, and it's based on our dependence on subways. We understand that the reason we use the subway so much is that we like to walk so much. And even though there is the last mile problem, even in New York, we don't see it, we see it less as a last mile problem and more as a last mile opportunity. You know, the last mile is that increment from your subway to your doorway. And we figure that if we improve the quality of walking in New York, we will keep subway use high, and we have the inadvertent side effect of getting people to write songs about it. And this has been happening now, literally for centuries. There's a 19th century song called Sidewalks of New York. Of course, Frank Sinatra had some pretty good songs about our sidewalks, and now even Alicia Keys and Jay-Z are singing about it. So to make a sidewalk worth singing about is actually a very difficult job. And it's difficult not because of technicalities. It's difficult simply because there is a finite amount of space in the public realm between property lines. That's what defines the right-of-way, the space between the property lines. And in that space, you have a large laundry list of functions that need to go. Everything from bike lanes to bus lanes, from truck routes to tree pits. Each of these functions takes up a certain amount of space. And in order to make the street, you have to make decisions. You have to decide which is more important in the hierarchy. And in doing that, things get left out. But in doing that, your values, your preferences are revealed. So ultimately, in a street in New York, we put the pedestrian first. That's how we judge if it's working. Putting the pedestrian first dovetailed perfectly with Karen's endeavor at the Health Department to increase health by increasing physical activity. When we started, we like to sort of jokingly summarize that what we're trying to do was simply to get people to walk, ride their bike, take the stairs, and eat their vegetables. Easy things, but very hard to regulate, very hard to get built into the fabric of your city. And the active design guidelines were a primary tool of getting this strategy to disseminate, not just amongst all the agencies in New York, but hopefully outside of New York, where the more projects that are built, the more evidence is accumulated, the stronger the argument behind these guidelines becomes. Karen went over several of these. I'll touch on a few. They include building design strategies that involve recreational programming. These are very subtle things. Again, they're not particularly difficult to do, but they're hard to articulate, and they're hard to make visible. But once you see them, they become, but of course, why didn't I do that in the first place? Look at the picture of the children's play bus. It's on the other side of a glass wall from the adults' exercise machines. And it simply recognizes that if you're a busy parent, you're not going to take the time to go to the gym unless you can also watch your kids at the same time. So both generations exercise at once. A parking lot, when it's not full, becomes kind of a whimsical hopscotch, a place for tricycles. Stair use. We're trying to increase the use of a main stair. Obviously, when you have 80-story buildings, encouraging stair use is a slightly tricky problem, but typically most buildings on their entry floor, between either a sky lobby or a basement, have a place for a main stair. And if that stair can be made to have natural light, if it can have visual interest, if it's inviting, that's the stair in the Apple store in Soho, there on the edge, there, the glass one, people will use it. And Karen has shown you the caloric benefits of using a stair, but it definitely also builds in a certain importance to the act of entering the building. We had to use these stair diagrams saying burn calories, not electricity, primarily because stairs are so typically hidden in modern construction. I'm an architect and was trained to put the fire stair back where no one saw it. In fact, I don't even call a stair. I immediately, just reflexively, called it a fire stair. It was something that was meant to be walled off, given a fire rating, and then put somewhere where it didn't take up space or prominence. No wonder in such an environment, elevators became privileged. Well, now through the signage and through the design guidelines, we want to even the playing field between stairs and elevators and make that point of decision a natural one and not one that is biased based on a practice of hiding the stair. When I talked about how important it is to make the walkable environment good, you'd be amazed at how much regulation affects the street wall. And by street wall, I mean the edge of the street that is built when buildings touch, and those buildings have openings and shop windows and doorways. In all the zoning regulations we write, we look to maximize the variety, the detail, the texture, the number of entrances to make it interesting walking down the street. As a rule of thumb, and I guess it applies to Canadian football as well as American football, I think you have to have something interesting every 10 yards, or else you're going to lose the interest of your pedestrian. And in American football, it's a first down. I don't know, did you get 4 downs to get a first down in Canadian football? 3. Wow, you guys are efficient. I don't know, you have to play a lot faster. That's a lot harder. Wow, okay. On a building scale, too, it's amazing simply what design changes that really have no cost to the building, but are simply a different way of thinking about them, like dividing the facade up vertically. So as you walk down the street, you see it in perspective and you see it change with every step. These are important. And they dovetail with our public space design strategies, most specifically with a project we're just finishing up now, which are sidewalk design guidelines. We treat the sidewalk as a room. You know, we look at it a little bit like an architect might look at it, you know, as having a ground plane, sidewalls, a roof, even though that roof is essentially the canopy of trees, and one of the walls is the street itself. But a multiplicity of elements go into building up each one of those ground planes, and what this study has shown us is that they often tend to be regulated by different agencies. For instance, the Department of Transportation might regulate aspects of the street furniture, but the Department of City Planning might regulate the frequency of openings in the shop fronts. They all have to come together in order to make a complete sidewalk that is sort of both a pleasurable and an effective experience to keep you walking. In designing policies, we talked earlier about the FRESH program and how on the eating your vegetables side of things, but it might be interesting just to talk for a moment about how this happened between our agencies. Department of Health came to us and talked to us about something called food deserts, places where people didn't have access to fresh fruits and vegetables. And we helped them by using mapping techniques of geographic information services and found an interesting corollary. The highest rates of diabetes and obesity were in those food deserts. So together we crafted a policy response. We designed a policy. And that policy was to give a zoning incentive to people who built buildings in those food deserts that provided a store for fresh fruits and vegetables. Simply an example of how much coordination is needed to accomplish a relatively simple fact, and also how much coordination is needed to reveal a dependent variable that can then be addressed through policy. Finally, I want to finish up with an example. It's an example of creativity. No, we don't yet have the Statue of Liberty generating electricity, but we do have a new park in the sky, and this park is probably the best walk in New York City. If you haven't done so already, the next time you go to New York, please walk the High Line. The High Line is actually a rail line built on the west side of Manhattan. It was built in the 1930s partly by Robert Moses, to elevate an old rail line that used to go at grade on 10th Avenue, which had become known as Death Avenue because the train ran over many people, even though the railroad company would hire a cowboy to ride a mare in front of it to try to shoo people away. Well, that was not an effective public health solution. This was far more effective, quite expensive, about $1 billion in today's dollars, to build an elevated 4-track railway across a large swath of western Manhattan and include into it a fantastical set of factories and storage areas. Unfortunately, by the 1980s, the factories had all relocated first to the south and then to Asia, and there was no use anymore for this structure. Several people, some speculators, had bought the land under this structure, and under New York zoning could build 3 stories on that land if the structure were demolished. And actually, in late 1999, had gotten the mayor to sign a demolition order. They were stopped at the last minute by 2 community activists, Joshua David and Rob Hammond, who formed something called the Friends of a High Line. They didn't know exactly what to do with this structure, but they felt that it was important to keep it and think about it. One of the Friends of the High Line became the chair of city planning, Amanda Burden. And under Mayor Bloomberg, who took office in 2001 began his term, the agency put its weight and intellectual capacity towards thinking, how could saving the High Line happen? And they realized that it was a combination, that to save the High Line, to turn it into a park, we would have to devise some kind of regulation to amplify its benefit across a neighborhood. We came up with several guidelines for what it had to do. Yes, we had to transform the High Line into a park, but we also had to use that public investment to provide market rate and affordable housing in the neighborhood. We also didn't want to ruin a great gallery scene that had grown up in this neighborhood near the High Line. We wanted to change the land uses in the area to go from manufacturing only to a mix of uses that would keep the neighborhood lively 24/7. And finally, we wanted to ensure that the buildings that did grow up around this new park, if they were to be built, would be built in such a way that kept light and air and views to and from the park, that essentially cradled it rather than obscured it. So we began by taking the existing zoning, an M15, and we made a zoning text amendment and a zoning map amendment to do something called the Special West Chelsea District. We drew the perimeter around the neighborhood, added new residential uses on the edges. We kept the manufacturing zoning in the center because we didn't want, that's where these art galleries were, which were able to use the manufacturing zoning. And then we added something called the High Line Transfer Area, which allowed people who own land under the High Line to use that land and the value of that land to make money off of it by being able to transfer it to these new receiving sites on the edges. And what's more, because that land previously would have been only for manufacturing, which had a relatively low value, but now could be used for housing, so that land area became much more valuable. And so the landowners dropped their opposition to saving the High Line as a park. We worked very hard to understand what the building adjacency should be. We used our technique of drawing to understand it. We came up with bulk guidelines that would, in essence, cradle the High Line, and we applied those to an area for the whole stretch. And here's a very quick example of one piece of land that took advantage of the transfer zone. The building on the left is called High Line 23. It's built in an area right adjacent to the High Line, and the area that would have been built there was transferred over to this building, which is on the West Side Highway on 11th Avenue. I'll show you in a diagram a little bit how this works. This is an axonometric view of the neighborhood with the High Line in brown and the land area of High Line 23 in yellow. If we had torn down the High Line, we could have built it back there for a few stories of manufacturing. But because we came up with these bulk rules and decided to save the High Line, we're able to push a certain amount of the floor area into that tower form there. The remainder of the floor area could then be transferred over to 11th Avenue, and the resulting process delivered a very high-end building on 11th Avenue, a very handsome building on 23rd Street, and the High Line itself. The economics are staggering. We spent $100 million on the High Line to convert it into a park. That's quite a bit of money. But the results of that $100 million have been $2 billion of private investment and counting. We've made over 3.6 million square feet of new space, over 2,500 apartments, created 12,000 jobs, and have found this to be one of the best public investments that the city has made over the last decade. I'm very interested in this model and how it can be replicated elsewhere. To me, it's the best example of aligning policy, finance, and design in a way that gets you your policy objectives, but transforms an area, not just a project. So I use it over and over again, and I'll conclude with this, and then we'll open up to questions. But that, I think, is the goal and use of urban design, to take a public good and use it to transform a larger neighborhood in a way that will let us all meet our goals. So thank you.
Thank you, Alex and Karen. We have a few minutes for questions, and we have microphones out there that I am to direct traffic to, according to Harriet. So, brave souls, I'm sure there's a door prize if you make your way up there and ask the first question, and if you don't, I will. Oh, here comes someone. Thank you. So to this microphone here, for Alex or for Karen?
For Alex.
Okay.
To build on your last example, I'm told that LA are trying to do a similar park over the freeway. Do you have some connection to the LA community? It's similar, connecting two sides of a poorly designed, and so is there going to be something over the LA freeway that's similar to Highline Park?
No, I don't know. I haven't been to LA in quite a while, so I don't know the answer to that. I do know that pretty much every official from every city that visits me in New York, I end up giving a tour of the High Line to. I've given the Prime Minister of Singapore a tour. I've given the Mayor of Shenzhen a tour. And I think a lot of people are jumping to the conclusion that they can replicate the High Line simply as a piece of infrastructure. But I want people to understand they can replicate the High Line as an alignment of policy, finance, and design, and a tool of transformation.
Did the difficulty of getting the air rights moved over to other buildings, was that the challenge, or was because the city wanted that, they facilitated that?
It was a challenge to conceptualize that and turn it into law, but the minute the zoning passed, there were closings within a day. I mean, it was amazing how well this mechanism worked. And it's a mechanism, it's not unique or unprecedented. It was actually first tried out when we had to save Grand Central Station from demolition, and we came up with the transfer of air rights based on historic preservation. That was upheld in the courts, and it became a tool in our toolbox. Applying it here in this fashion was novel, but effective.
And I presume it improves the air quality in that area as well.
Oh, the air quality is fantastic there.
Thank you.
Thank you. This microphone, please.
Have you run into a fellow named Stephen Ritz, the Green Bronx Machine and urban farming up in the Bronx area?
Oh, not that name, I don't know him personally, but I've been associated with a few urban farming initiatives. We actually have a developer who's worked very closely with us on active design, Les Bluestone, that just opened up a building in the Bronx, an affordable housing building, where he put a hydroponic greenhouse on the roof. And it's doing very, very well. I think urban farming it's a great concept, and I think it can be done in a variety of intensities. But hydroponics really, really juices your output. And we know there's something called the Brooklyn Grange that does regular farming on rooftops. Even though they're called the Brooklyn Grange, the particular rooftops they're doing right now are in Queens. But they were telling me that they get something like 15,000 pounds of produce from a rooftop and several hives of honey. I love that concept, and I think it reinforces, if there were one rule that I could write about buildings, it would be that every building should produce a percentage of the resources it consumes, whether that's food or energy
Alex's
or space.
rule.
That would be my hope.
Karen, I see you taking the mic. Did you want to make a comment on that one?
Yeah, no, I just wanted to add that, a number of buildings that actually have used urban agriculture are actually the same buildings that have used the innovation credit or the pilot credit for physical activity. Les Bluestone's building called Arbor House in the South Bronx, it's got a hydroponic farm, and one of the things that we actually did with Les as well, in addition to the physical activity innovation credit, we helped him create also a urban agriculture credit. And that USGBC is currently considering for pilot credit library as well in the next phase. And then Via Verde, which is another award-winning affordable housing building in the Bronx, they actually, as part of the active design credit, innovation credit, has gardening space, but their gardening space is not a hydroponic farm, and so it actually allows residents to undertake community gardening on their green roofs, and because of that, of course, that's a physical activity when residents are actually gardening. So they actually have a whole communal gardening club to complement the garden spaces that they've created on the roof.
Do any of you guys have green roofs or garden on your roof? No? Yeah, okay. It's actually not that hard to do, and it's very, very pleasurable. Okay.
Okay, well, others are thinking of questions. I wanted to ask either of you to comment on the sidewalk study that I think is coming to completion in the next little while in New York.
I'll just start by saying that I think, Gayle, after the active design guidelines came out in 2010, so as the city's been busy implementing the active design guidelines, a couple of things happened. One is, questions would come up around things like, so for affordable housing developers, we had, early adopters like Les, like Via Verde, who took it on, but there were actually concerns by some others about costs. So we've actually started to do a whole host of things and have some addendum and supplement documents now that have come out or are coming out in response to some of those issues that have been arising. So one is costs in affordable housing. So there's now actually a new study that we did in Atlanta, San Antonio, and New York that focuses on costs in affordable housing of implementing the active design guidelines. So that's out. You can go to centerforactivedesign.org/affordable housing costs to generate that. To get that document. There's a supplement document on the synergies with promoting safety, because many of these issues will promote safety both in the public realm and private realm. The next document that's upcoming is a sidewalk study. Basically, the Health Department got a grant from the Centers for Disease Control and Prevention a couple of years ago to mentor 14 other U.S. cities on this work. And one of the, some of that funding actually went to Alex's shop in city planning to basically work with a whole host of these cities to measure sidewalks and to look at what best practice sidewalks look like in different cities in the US. And so the study will be coming out as a publication at Fit City 8. So, but Alex might be able to give a little bit more insight into that study.
Sure, sure. How many of you have young people who want to change the world working for you?
How about living with
Yeah,
you?
good, good. Okay. Well, this sidewalk study, I think, was a perfect example of scope for that. You know, when we worked with Karen, we got the grant. I sketched up the idea of treating it like a room a little bit, but we had to learn what that really meant. And we have a wonderful young urban designer associate named Sky Duncan, who works with me, who took this on and made this her own. And she organized sidewalk safaris that went with volunteers to towns across the country, and whatever the weather, and she made them go out in very cold weather as well as very hot, they would measure everything down to the inch and draw that up. And we came up with a methodology for surveying and sampling your sidewalk and being able to compare it to metrics of these other sidewalks that we encountered on this tour of sidewalks. But it's an example of something that could never have been done by a consultant, because it required too much passion, I think is the only word, you know, the creativity and the willingness to go out and do whatever it takes to really document these sidewalks. And I just feel very, very fortunate that I have Sky working with me, and that we also had many interns that came from all over the world and accompanied her on this.
Well, it's interesting you should say that, Steve, because we were working on the design of some space, seeing no questions. I'm going to just tell you the story. Beside that building I mentioned at the beginning, where we have 1,000 employees who get in their cars, race out, try and get some food, and race back, plugging up the streets. Probably the bargaining employees may be taking a little longer than is actually allotted for lunch, because it's just so hard to get out and eat and back, especially when they're all doing it simultaneously and creating that demand. So we wanted to create space beside the building where people would actually eat and have meetings and be active. So we got some University of Guelph master's students, and I felt absolutely ancient when I looked at them and when we talked with them, because they said exactly that. Well, we did it because it was inexpensive, but so this is making me feel good about the decision. But they made me feel ancient because we tried to explain to them, you see, when you start working, you'll be sitting at a desk or in meetings for 4 hours. And you could see it wasn't going into their minds that that's what their work life was going to be like. Their attitude was, no, that's not how I'm going to spend my working life. And they design space in a way, in a sense, as you say, that we couldn't even imagine, because they think about it so differently. For us, it's like a brick wall to think about how we're going to make the space usable, but for them, it's very natural. So that's reassuring, Alex, that was a good decision. Just as a final couple of thoughts, I want to just touch on this idea that people are starting to think differently about how they want to live their lives in the space that's available. So for either of you to comment on what lies ahead, I think it's telling that you had a first study that showed, I think it was 56% of people wanted to live in a community that might provide them with a smaller house and smaller backyard, but more opportunity to be active and more time because they're not commuting as much. I also think it's interesting that 14 other cities in the US have asked for funding or received funding from the Center for Disease Control to do this work, and I'm curious about what kind of successes they're having. So for either of you on the other cities, or our children who say they don't want to live the commuting two-car large house life that we do.
I think, Gayle, the study that I cited from the National Association of Realtors, that's showing that in the U.S. But I was in Australia, actually, doing some work with 4 Australian cities in February. And what was interesting to me was some of those cities there, they've done similar surveys on real estate demand, and they're showing, similar results, where the majority of the population now are actually wanting to live in communities that are more walkable, where they have the options to walk, take transit, to run errands without having to get into the car. So I think this is actually a global trend, not just one that we've seen in the U.S. I was on a panel in Sydney where there was actually a developer who had actually created a development that was much more transit-oriented and walkable. But it was out actually in a more suburban neighborhood, but on a transit node. And he was saying he had never seen his development sell so quickly. It like exceeded his expectations, and and so it was really, I think, really heartening to see that in fact we have these synergies that can be brought together. In terms of the U.S. cities that got funding from the Centers for Disease Control and Prevention to do this work around built environment change and policy change to impact obesity or diabetes, Gayle, it wasn't actually 14 cities. It was like 14 cities who ended up working with New York on this mentoring, but we actually had over 30 cities in the U.S. that were actively doing work around the built environment and built environment improvements to address obesity.
Now, I'll take a slightly different take on it and say that rather than a specific type, what people really want is choice. And Christopher Leinberger has done some good studies where he simply came up with, depending on what period of their lives people are, about 30% of people want to be in suburbs, 30% of people want to be in walkable downtowns, and 30% really don't have an opinion. It's just sort of whatever's cheapest or more convenient. The reason I think even those 30% are important is that the base we're going from now is that we're probably at about a 10%-ish of walkability. So there is a 20% increment ready to be met by the market, which when you consider the scale of the United States and Canada is probably I would say like a $500 billion market or so, that 20% increment of the housing market.
Yeah, that's quite powerful. All right, question, Janet, go ahead.
A question about the culture in your organization. What contributes to an environment that brings health and planning together, and to the examples of innovation that are right outside of the box, and just the can-do, we have to find a way to make it work attitude. I'm just so blown away by it. How do you get there?
Well, it certainly helps when the people are as charming and beautiful as Dr. Karen Lee and intelligent to do this. Yeah, I think.
Okay, after that side of the way, then what? Because we don't have that.
I think. Listen, I think we're both very fortunate to work in the Bloomberg Administration, which has gone out and hired people because of what they can do, and then let them do it. And I think that, when we got together, and remember Lynn Silver was there at the time too. When you're in a work environment that permits and encourages you, and in fact is looking for creativity to come out of government, that then you naturally gravitate to those people that you can recognize. You don't know exactly what it is, but we recognized immediately that there was something that could really benefit both of us in this, in our agencies, and that working together would help find the answer.
Yeah, I would say that, a lot of people have asked us that in New York, is it this particular administration? I think, clearly having supportive leadership is something that's very helpful. I think, though, that, a big part of our successes have been, creating forms of dialogue where different groups can come together to share ideas and to share ideas out of the box. I think when you actually work across sectors, it fundamentally pulls you out of your own box, right? And so having these regular forums like we've had with Fit City that are not just a one-time thing, but an ongoing thing that basically allows different sectors to come to the table and to be challenged by each other. Right? And to actually share what they know within their own sectors with another group that has never even thought of those issues or those opportunities, I think that already pulls you out of the box. So I think that there's a role for both. Leadership plays a critical role in sort of setting the tone, but I think, internally and even at staffing levels, there are many things that we can do to create forms of dialogue that will bring out some of that creativity, that would actually pull us out of our routine daily boxes to generate more creativity together.
And just as a governmental technique, I would say having certain categories in your work programs that are relatively loose, in the sense that we knew at city planning we wanted to do something about fit city and fit nests. We didn't know what specifically, so the work map prodded some time, but did not have, it also allowed room for brainstorming and creativity on that.
Yeah, I would echo Alex's point as well about, actually allotting some staffing time for that. Because even in the health department, right, when it wanted to start the intersector work, one of the things it had to do was it had to create my position so that there would actually be a point person who would start the outreach and the discussions with other city agencies, who would actually plan those forums of dialogue like Fit City, like the Fit City conference. Because without sort of some dedicated time, it's actually, we're all busy people, and it's difficult for it to be given any priority without that.
And one final thank you. I think we should also remember people like the AIA and outside groups that gave us a forum, kept our spirits up, and I think that's necessary too. You need someone on the outside to encourage you when things look tough.
Like professional associations like the American Institute of Architects, the New York chapter. We've worked with the American Planning Association, New York Metro chapter, with the U.S. Green Buildings Council, New York chapter, and then also actually, when it came time to actually develop the innovation credit, we actually ended up working with U.S. Green Buildings Council National, because we wanted a credit that ultimately New York City could start and utilize in our own buildings, but that could be adapted and used in this national and international system that they had.
Thank you. So on that note about keeping our spirits up, you've done it again. You brought us inspiration, eh, Steve? This is what we wanted. And ordinary minds would collapse under the weight of thinking through this kind of land use, transportation, health integration, but the two of you and your colleagues have risen to the challenge. We should give you an honorary degree. I'm not sure what it would be, and the discipline hasn't been invented. People who could work in many disciplines simultaneously. But I want to turn it back over to Steve once we say thank you to you. I want to thank my staff who helped organize today's event, Rebecca Fortin, and Steve's staff, whose names I do not know, and ask you all, as Steve comes up to the podium, to do active applause, which is something we learned from New York. So you stand up so that you're not sedentary for another 20 minutes, and clap for Karen and Alex. On your feet, soldiers.